small-bowel capsule endoscopy and device-assisted enteroscopy for diagnosis and treatment of small bowel disorders, European Society of Gastrointestinal Endoscopy, ESGE, Technical Review. This technical review complements the recent European Society of Gastrointestinal Endoscopy, ESGE, Clinical Guideline on Small Bowel Capsule Endoscopy, SBCE, and Device-Assisted Enteroscopy, DAE, for the diagnosis and treatment of small bowel disorders. The aim of this complementary technical review is to discuss technical issues related to the use of both SBCE and DAE, providing guidance for clinicians on optimal performance of these procedures in clinical practice. Introduction and aim. Small bowel capsule endoscopy, SBCE, and device-assisted enteroscopy, DAE, have been used in clinical practice in Western countries since 2001 and 2005, respectively. Their combined use has revolutionized the approach to the investigation and management of small bowel pathology, modifying well-established clinical models, e.g. the definition of obscure gastrointestinal bleeding, and leading to the development of new diagnostic and therapeutic algorithms. In 2015, the European Society of Gastrointestinal Endoscopy, ESGE, issued a clinical guideline that focused mainly on the role of SBCE and DAE for diagnosis and management of small bowel disorders. Technical and practical aspects were not discussed. Similarly, in other reviews and guidelines, technical matters such as preparation schedule, reading and reporting protocols, sedation regimens, and choice of DAE insertion route, which have been shown to impact on the diagnostic and therapeutic yield, are only partially addressed. In order to complement the 2015 clinical guideline, ESGE commissioned and funded this comprehensive, evidence-based technical review. The endoscopic technique itself has already been described in detail elsewhere. This technical review therefore focuses on other unaddressed SBCE and DAE-related technical issues in order to provide guidance for clinicians on the optimal use of these technologies in clinical practice. Methods. The procedure definitions adopted in the present technical review are in line with those of the clinical guideline. DAE includes double balloon enteroscopy, DBE, single balloon enteroscopy, SBE, spiral enteroscopy, and balloon-guided endoscopy, BGE. The evidence concerning the latter technique is very limited, thus the present technical review is focused on DBE, SBE, and spiral enteroscopy, DBE and SBE being grouped together as balloon-assisted enteroscopy, BAE. Since some DAE technical issues differ completely between adult and pediatric patients, the present technical review focuses on the management of adult patients.